Hey there, thanks for clicking through. I really appreciate you taking the time to find out a little bit more about this whole off medicines and reducing your reliance on medicines thing, right? So here's how it works. I really want to help you, and in fact I want to help 40 people in this year to come off or significantly reduce their reliance or dependence on medicines, particularly the ones that are used for anxiety, depression and hypertension or high blood pressure. So if you're one of those people and you're taking one of those different medicines and you want to come off them, you've got to want to come off them first, right? You've got to have a desire. Maybe you're sick of just the symptom treatment of them, or maybe you just don't think that you want to be on them the rest of your life. So if that's you, then you come to the right place. I really want to help you come off them. Now you're probably thinking, who the heck is this guy and what does he know about helping people come off medicines? So I used to be a pharmacist. In fact, I'm probably what you'd call an unpharmacist at the moment. I used to be a pharmacist, did that for several years, realized that wasn't really helping. The people I saw keep coming back, they get more and more medicines, helps the symptom definitely, but not necessarily their overall wellness. So I ended up leaving that and I went and did some other training. I'm a personal trainer as well, and then I did nutrition, then I ran a gym, then I was helping people to make the lifestyle changes that they need to make, I thought, to not be on medicines in the first place, right? That was all well and good, that was fine, that worked for some people, but not for everyone. Okay, so even when we're doing all the exercisey stuff and all the nutrition stuff and being really good at both of those things does not mean that you are well all of a sudden. Okay, so there was another part that was required that I did even more study in. So I left doing all that whole nutrition exercise stuff. I still do it and I still think it's really important. I do it myself every day. Realized there was something else missing. It's about the mindset, right? Helping get your mindset in the right place, helping you to understand how your unwanted emotions are affecting you, right? And how that has an impact on your physical well-being. Right, this is an area called psychoneuroimmunology, basically how your thoughts and your feelings affect your physical immune system, right? So you can see how medicines fit into all of that as well. So this is another part of what I do, and I've been coaching people for years now about how in all of those different areas I've mentioned, but particularly now in how to help people to become well. Now, a side effect of that is that they don't need their medicines anymore, and so they come off them or they reduce what they're using. So that's what I'm trying to do, and this is what I want to help you with. So if you're one of those people, now I mentioned before in the video that you need to be willing to change, because there were definitely going to be some patterns, things that you've been doing your whole life probably, that need to change in order for you to become better as a wellness perspective, right? And so you need to be willing to make changes. Okay. The other thing is you need to be willing to give time and invest time to doing it. Now for some people, time is worth more than money. Okay, so you need to take time out of your busy schedule, out of the stuff that you've been doing. You need to take time out of that and contribute it towards investing in your wellness, right? That time. That's the requirement, the minimum requirement is that you see me 45 minutes every fortnight for at least 6 to 12 months. And that will depend on what medicines you're on and how well you are and where you are at the point of starting, right? Okay. The next part of that is, yes, you also need to invest money, because that will take a lot of time as well. So you've got to invest your time, and I'm investing my time, and you invest your money, right? Now, it's a minimum. Okay, this will probably be a shock for some people, but it's a minimum of $2,500 per 6 months. Right? I said it's a minimum 6 months, so it's going to cost you at least $2,500. Right? So immediately, some people may not feel they fit in that, but I want to encourage you to find the $2,500 you need to get started. Right? Because what is you being on these medicines and you experiencing those symptoms and those conditions? What is that currently costing you personally? What is it costing you in your quality of life? What is it costing you in the relationships that you have with family and loved ones? What is it costing you in the activities, the enjoyment you could have been having if this wasn't a restriction for you? What are you currently missing out on? And then look at all the things that you are currently restricted from doing, or that you're missing out on, or the quality of life that you are not enjoying at present, and compare that to $2,500, right? And if you did it for a whole year, $5,000, right? Is it worth it? That's up to you to answer that question. but that's what is required. Now, another part of this is that you need to be willing to change and be willing to be taught and coached and supported and guided to make the changes that you need. The quote that goes along with this that I love, that I've been using for so many years now, is ordinary people like you and I who consistently do the small and simple things that are right can achieve extraordinary results. Now, who's to say that one of those extraordinary results couldn't be coming off or significantly reducing your reliance on a medicine? I believe it can be done. I have done it. I've helped many people come off medicines, even antidepressants, even those used for anxiety, those used for hypertension. And I want to help another group of 40 this year to do the same. If you are willing to do that, please fill in the application below, right? Be specific as you can. We want to know a little bit about who you are, what it is that you're trying to achieve, what medicines you're on. We want to know a lot about you because we want to make a decision, an informed decision, to get the right people into the program, right? The right people that we believe are going to go all the way through and achieve it. You'll get a chance initially to find out if I'm the right person to help you, and I'm all good with that. I'm happy to give you a free session initially so you get an idea for who I am and how I work, and then you'll be able to decide whether or not you're willing to invest in me helping you to achieve that. And finally, it's important for you to think about what is it that you want to achieve as a result. So not just reducing your reliance on something, but what do you want to get? What is it that you want to improve in? What do you want to now do because or when you come off them? All right? What is the quality of life that you are looking for? That's going to be your driver. That's your why. That's your reason to doing it, right? So it needs to be clear for you so that you know why you're going to go through these changes, why you want to make all the changes, especially when it gets hard, because I'm not going to lie, it gets difficult and it gets hard and you don't want to do it, and that's normal, right? So what is the why for you? You need to get clear about that, and we can help you find out what that is for you. So next steps from here, fill in the application below, fill in all the stuff, be as detailed and as specific as possible so that we can identify the right people, right, to come on this program with us. Then we'll organize a time for you to have a free 45-minute session with me, whether that be in person, on Skype, Zoom, on the phone, whatever, right? And you'll get a sense from me, and then you can choose whether or not you want to do that or not, and that's fine. Once we've done that, we'll get you straight into the program and start working with you every fortnight. You'll have a session with me, and there'll be stuff that you need to do in between. All right, this is not just a once a fortnight catch up. There's stuff that you actually need to do in between that. So you've got to be willing to make change. So that's what this is all about. If you're still listening, congratulations. I know it's a long video, but if you're still listening, congratulations. You're probably halfway there. Just get the stuff filled in below and send it in to us, and let's book a time with you. Sweet. Look forward to catching up with you.